Ms. Janet Ang.
Madam Deputy Speaker, thank you for the opportunity to participate in this debate on the Healthier SG White Paper. For a nation to truly prosper, its citizens must have good health. Those who enjoy good physical and mental health report high levels of well-being. An effective health infrastructure is critical for sustaining per capita income. Poor health keeps people from fulfilling their potential. That was a quote by Baroness Philippa Strout, CEO of Legatum Institute, a think tank in London. Legatum Institute ranked Singapore number 2 in the world for the health pillar in their LPI Index 2021. According to the World Health Organization, a well-functioning healthcare system requires a steady financing mechanism, a properly trained and adequately paid workforce, well-maintained facilities, and access to reliable information to base decisions on. The WHO's global study assessed healthcare systems around the world, and Singapore was ranked 6th in the world and the highest rank for countries outside of Europe. And as reflected in Figure 1 in the white paper, so I did read it, Singapore has been able to achieve good health outcomes, improving our healthcare system without incurring substantially higher levels of healthcare expenditure. It is not by chance that Singapore has been able to come out of the COVID pandemic with relatively low deaths. How we have emerged from COVID-19 reflects the resilience of our healthcare system, of our institutions, and most of all, of our government and our people. Kudos especially to the generations of healthcare professionals and policymakers who have strategically enabled us to more than survive COVID-19 and to emerge from COVID stronger together. The Healthier SG White Paper, which is being debated in the House today, is timely. Singapore is faced with a rapidly aging population, and we can expect, therefore, an increase in the proportion of people living with diabetes, hypertension, and other chronic diseases. As the saying goes, prevention always better than cure. We need to shift our emphasis from reactively caring for those who fall seriously ill to proactively preventing individuals from falling ill. Therefore, health screening, a healthy lifestyle, and education are the key pillars to disease prevention. We've got to add to that discipline. Now, at the same time, we need to sharpen our focus on the value of care, recognizing that there is a cost to care. Dr. Brent James, a renowned clinician and doctor of medicine, who was the chief quality officer for over 30 years at Intermountain Healthcare Systems and a senior advisor with Health Catalyst, as well as co-author of a book, To Err is Human. He suggests that value of care equals clinical outcome plus patient experience divided by cost. Prevention and going upstream has been proven to be the best way to improve clinical outcome. The community also plays a part in the reshaping of our healthcare model towards one that involves every resident and not just when they become a patient. Allow me to share 2 initiatives where I personally witnessed the community in action and the impact on the health and well-being of the seniors as well as the volunteers. Good Life Makan at Block 52 Marine Terrace is a program by Caritas Montfort Care FSC. Seniors in the neighborhood are encouraged to come together at the Good Life Makan Community Kitchen to prepare, cook, and share their meals with one another, and more importantly, to listen to one another's stories and to learn and support each other. Share a Pot is another community initiative which brings seniors together around a pot of hot, nutritious soup for them to enjoy, and also to rally each other to grow stronger and live well with broth and brawn. During COVID, Share a Pot went online and did its part to help the seniors stay connected. These kind of initiatives can become a part of the Healthier SG community partnership. I applaud Healthier SG for the comprehensive, holistic approach that it has taken. There is a lot to be done, but we'll need the whole of Singapore to be committed to act for a healthier Singapore. Continued dialogue with all stakeholders to clarify issues and collaborate on solutions as we take this forward will be imperative. For the rest of my speech, I will cover 3 areas. First, going upstream with the resident and family physician relationship. For example, at Intermountain, they incentivize the primary care network to keep people out of hospitals as much as possible. For their diabetic population, they invested additional 4% of budget in this group and achieved a decrease in hospital admits by 22% and a decrease of 21% for other avoidable visits and admissions, resulting in overall improvement in value of care and reducing overall costs over time. So prevention is certainly better than cure. Healthier SG is enlisting the primary care providers to play the central role in this healthcare model. This will cement the place of family medicine in delivering holistic and coordinated healthcare to all patients, reduce doctor and clinic hopping, and have the potential to ultimately improve rationalization of specialist care by public hospitals. Everyone I have spoken with agrees that this is certainly a step in the right direction, but caution that as in all things, the devil is in the details. How to implement and to implement it right from the start is the big question. Here are some of the questions which we hope MOH can clarify. While it is good for a patient to come under a fixed doctor or clinic, it may not always translate in practice. For example, patients seen at polyclinics often do not get to see the same doctor at every visit. Likewise, some GP groups employ locum doctors. Can MOH clarify if the intended enrollment is with a GP practice/clinic or is it with a named doctor? Can a resident be enrolled with more than one GP so that there is a second opinion or a backup doctor in case the enrolled doctor is on vacation or at a conference? Now, how does the enrollment work for the family pediatrician, the family dental surgeon, the eye doctor, and others? And by the way, will health screening include regular eye screening and dental screening? What happens to the residents who do not enroll? How will it work for residents with company-provided or insurance-provided panel of doctors? Can the employees consider the GP clinics of the healthcare partners as their enrolled GP? Phased approach is the pragmatic way to implement. After listening, because I am, of course, above 60, so in the category. But after listening to honorable members speak about it, I do hope that MOH can consider enrolling the students in IHL and the NS groups, as well as those who reduce the start age to 40, because usually it's the 40-something who will bring the 70-something to the doctor. So I think it is good also for research comparing the different groups, how they adopt and enroll themselves into such a program. Now next, the plan to use technology to help implement this program is laudable and should be explored. Love the idea of using the Health Hub app as a digital reminder to patients. To close the loop, there can be digital reminders inbuilt into the electronic medical record system, which prompts the doctor to check on the progress of the healthcare plan and ensure timely implementation. To take one step further, appointments with relevant care team members can also be considered to be implemented online. Therefore, the IT system, the Health Communications Network, and the National Electronic Health Record Systems are critical for the successful implementation of this initiative. MOH has done very well as it is in this space, but will need to continue to invest as more still needs to be done to ensure system uptime, efficient sharing and update of the patient's health records, while ensuring data is secure and personal data duly protected. There will also be a need for trained doctors, nurses, and staff to engage, educate, and support the patients in the enrollment and transition journey. What help and support will MOH provide to help the GPs and clinics transition to the level of digital that will enable them to perform their role in this healthcare model? According to Dr. David M. Eddy, the father of evidence-based medicine, it is now well studied and clear that complexity of modern medicine exceeds the capacity of the unaided expert mind. Solo reliance on the craft of medicine is scientifically untenable, unquote. It has been found that the best way forward is to develop evidence-based best practice protocol, blend it into clinical workflow, embed data systems to track the protocol variations, and strongly advocate that clinicians apply the protocol but subject the protocol to continuous improvement based on patient need, and thereby improving the protocol in a continuous loop applying Deming's Lean Six Sigma principles. Clinicians globally have found this approach to improve clinical quality and drive better clinical outcomes over time. I read from the white paper that our Singapore medical and clinical professionals are exploring such best practice methodologies, and I applaud it. Now, finally, let me speak briefly for the digital naive, the vulnerable elders, and the foreigners. In spite of the best efforts of IMDA, GovTech, and their volunteers, there is still a large group of seniors who may not be digitally savvy. How will MOH onboard this segment of citizens who are digitally naive and who are likely to be from the lower income households? Will we consider similar initiative like they did in Japan, where the neighborhood postman becomes the point of contact for this group of vulnerable seniors? And for vulnerable elders, will home care and support for end-of-life be part of this program? End-of-life care is expensive and underdeveloped. We will need to enable the caregivers and the elderly themselves to transition with dignity and with comfort. And lastly, considering that we do have a sizable number of people in our community who are PRs and employment pass holders or work permit holders, how will Healthier SG apply to them? In summary, the initiative is an excellent one. In the long run, it would lead to Singaporeans leading healthier and more productive lives. At the same time, there is opportunity for Singapore to create an innovative model of value-based care based on strong population health expertise with a robust digital health platform, an extensive telehealth network, and a compassionate and engaged community. We all need to play our part. Let me close with an advice from my mother-in-law, Mrs. Lily Chia, who is 99 years old, going on 100. Whenever she is asked, "What is your secret, Auntie Lily, for a long and healthy, happy life?" Mom's answer is, "Use it or you'll lose it." Madam Deputy Speaker, I support the motion.
Deputy Leader.
Deputy Speaker, on behalf of Leader, I beg to move that the proceedings on the business set down on the order paper for today be exempted at this day's sitting from the provisions of Standing Order number 2.
The question is that the motion moved by the Deputy Leader, as many as are of that opinion, say aye. To the contrary, say no. I think the ayes have it. The ayes have it.